Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today we are going to discuss about the examination of the eyebrow. Eyebrow, anatomically, it extends from the medial orbital margin to the lateral orbital margin. You can palpate the medial and lateral orbital margins. So it starts from the medial orbital margin to the lateral orbital margin. The eyebrow travels along the superior orbital margin. So you can palpate the superior orbital margin below the eyebrows. Eyebrow normally has a small convexity upwards. The hairs will be equally distributed. It will be equally distributed all along, but it will be somewhat thicker medially and laterally it tapers. That is a normal anatomy. Let us first consider about the abnormal shapes of the eyebrow. I already said the eyebrow is slightly convex upwards. If the convexity of the eyebrow increases like this, it is more convex like this, in which condition you will see. Whenever there is a ptosis means drooping of the eyelid. The eyelid is not able to go up due to the levator palpebrae superioris malfunction. When the eyelid cannot be opened by the LPS muscle, the frontalis muscle on the forehead tries to somehow open the eyelids with extra effort. When it does like that, it pulls the eyebrow up, so it becomes more tented like this. So, levator palpebrae superioris muscle problem, or due to ptosis, the overaction of the frontalis muscle leads to more convexity of the eyebrows. Sometimes the eyebrow may be flat like this, may become flat like this. It will not have any convexity at all. In which condition you will see this? In case of frontalis muscle paralysis or facial nerve paralysis, because the frontalis is totally flaccid, the eyebrow becomes flat. The next thing we have to see is the hairs in the eyebrow. The hairs in the eyebrow, usually it takes very long time for graying. If it becomes white in color much ahead or in a very young age, it is called as scoliosis. The extent of the eyebrow may also be altered. Sometimes the eyebrows may be large on the lateral aspect. This is classical of a disease, that is Hansen's disease or leprosy, in which the lateral portion of the eyebrows will be absent. That is called as leonine phases. So these are some of the abnormalities an undergraduate and postgraduate beginner should know. So whenever you want to examine the eyebrows, you should examine the extent of the eyebrow, you should examine the shape of the eyebrow, you should examine the hairs over the eyebrow. With this, we will stop here. We will go to the next structure tomorrow.